Hello, sir.
Hello.
Myself Rahul Patel. I am from basically Gujarat, and we are here in the BAU International University. So I just want to know about few things about this university and their education system and all. So first of all, I want to know about the basic education system. Means what kind of course over here? Means it's purely European standard system, or you will also include the USMLE or Indian FMG pattern also in it.
Okay, thank you for the question. Nice to meet you, first
Yes.
of all. As it's mentioned in our name, we are BAU International University Batumi, so we are focused towards international education, and we were the first university in Georgia who implemented the American model program. So most of our graduates are looking forward to the US, and respectfully, they try to focus on the United States medical licensing examination, USMLE, as we call it. So our program is integrated, is totally integrated. It's different from the programs of other post-Soviet countries where they teach medicine subject by subject. We are teaching it system by system using horizontal and spiral integration within the medical education. And our program also includes USMLE and FMG preparations. So as I said, our students looking forward for the USMLE exam. So we introduced USMLE preparation courses totally free of charge. So the students who are planning to go to US, they are selecting these as elective courses during their study, and until they graduate, they have the opportunity to pass several stages of USMLE. I want to mention that the students who use this course and registered for the exam have scored in the top 10% of highest performant exam takers of the USMLE. And in the later years, there was a growing interest towards the FMGE exam. That's why we introduced as well FMGE coaching for the Indian students using Indian professors we are bringing from India and using Indian coaches to get students more acquainted with the peculiarities of this exam.
So you mentioned that it's an integrated program with the USMLE or like that. So as of now, any student pass the USMLE exam?
Yes. The graduates of the last 3 years are passing USMLE, and right now we have a 100% pass rate. So everybody who registered, they have passed, and some of them passed with a very high score. So we are really proud of our students, and we are happy that this novelty which we brought to education in Georgia worked out, and it brings big interest from the students from India and from 25 other countries from all around the world.
Okay, and what about the examination system over here?
Yeah. The examination system is electronic, so the students have to take their midterm and the final exam within every subject during every semester. The system is totally anonymous, so the students log in within each system. He sees the tests that are totally randomized for each and every of the students. And we use different approaches for exams. We use multiple choice questions. We use open questions. We use integrated clinical or biomedical cases to see and evaluate the problem-solving skill of the students. We use clinical case presentation for their last year of study whenever they bring real-time cases from their clinics, and they have to present it between the committee of the doctors. And we also have scientific projects in our program for which students have to conduct the research, make and publish the paper as well. As I said, the examination system is totally anonymous, and even teacher is not seeing whose paper he is checking. We introduced the comment system, so the student gets the reply and feedback from each and every professor for each and every mistake he or she might made. And it is important for us as well because we are giving a scholarship for all our students based on the merit. So the students value each of their points, and I think it's a good work ethics, it's a good professional attitude we're trying to build within our student community.
And what is the student-teacher ratio over here?
Student-teacher ratio is 1:5. It's one teacher to 4 or 5 students maximum. So we have a lot of clinicians, we have a lot of biomedical professors, and I think this ratio ensures that the teaching process is sustainable and teaching process is equipped with good teachers. Our teachers are not only from Georgia, we have lots of the teachers from the neighbor countries, and We try to bring teachers from abroad. We have Spanish teachers, teachers from Switzerland, teachers from India, teachers from Finland, teachers from Germany, teachers from America, despite of time zone differences. Still, sometimes we manage to organize this process, so we try to provide international education in Batumi.
Okay, and what about the clinical exposure part?
Yeah, this is one of the crucial part for becoming the medical professional. So we introduce early clinical exposure in the very first year of study. So the students start from the observing of clinics and observing the operations and day-to-day routines of the doctors and other medical professionals. After a while, from the third year, we move them to the simulation center where they practice their clinical skills first on the mannequin, then in virtual reality, in the virtual patient. And from the fourth and fifth year, they have longer clinical visits to the different departments, to every department, every sector of medicine. And after 5 years, it all ends with 12 months clinical internship, from which they spend total year in the clinics, assisting the doctors in all their daily procedures, who will be medical paper making, record making, gathering the anamnesis, diagnosing the patient, and following up with the treatment.
And for the USMLE, the clinical exposure part in the US is also required, means the clinical rotation part. So are you have a facility?
It was one of the biggest challenges for us, definitely. And that's why we partnered with the American company, which provides clinical practices in several university hospitals throughout all the US, East Coast and West Coast, both of them. And they are different departments, there are different options available for the students, but this option that is provided solely by BAU in Georgia, it's one of the top options that the students are required and students are expecting to have their clinical internships in the US as well. We provide clinical internship possibilities in other countries as well, in Asia, in Europe, both, but this American internship program, I think, is one of the most popular because, as I said, like USMLE is one of the biggest goals and objectives for our students. We also, for this USMLE notice, that's why we introduced also OSCE evaluation and OSPE evaluation in the clinical and biomedical parts, respectively. So the students within each semester, they have to go through one integrated OSPE or OSCE exam to demonstrate their clinical skills, working independently, just being watched by camera and evaluated by people they don't see and they don't interact with.
So OSCE is, I think, it's a very means important part for the future USMLE qualified doctor, because in future they will get a different pathway if they clear the OSCE level.
Yes, we understand these novelties and we try to follow up with them. The transformation of the education, and particularly medical education in post-Soviet countries, were difficult. Georgia was one of the first countries who gained WFME recognition from the World Federation of Medical Education. And BAU in particular was one of the first universities who implemented OSCE, and not on the formal way, but for practically for every student for almost each semester of their studies, for the later semester of their studies especially.
And apart from USMLE, if you will think about the UK option also, so any kind of lab coaching or that thing available over here?
There is lab coaching options available as well. And also we made our programs checked by the PLAB officials because they count meticulously each and every clinical hour. And we have some students registered and some of the students already passed through the PLAB examination.
Okay, that's great. And if student will think about the European options like Germany or any other country, so any kind of language facility is also available?
You understand, whenever you want to practice medicine in a different country, you shall be able to understand and comprehend the language of the patient communication. That's why we introduced the various amount of the elective languages for the students to select from. European languages like German, French, Russian, or the Asian languages like Turkish and Iranian as well. So we try to give the students these possibilities, and we also work in recognition because like our university and our MBBS program is listed in Germany Ministry of Education, Council of Education's list, so it is recognized. And because Georgia is a member of Bologna network of for the recognition of the higher education in Europe. Our program, which was accredited by the international experts, by the European WFME certified experts, is recognized in Europe as well.
Okay, that's nice.
For our future is recognition in the other countries, so we actively work to obtain recognition for Australia. It was a request from our students, and we try to support their initiative and their career plans, and the future plans will go for the obtaining recognition in Arabian countries like United Arab Emirates and Saudi Arabia.
Okay, that's good. If, according to my knowledge, if student will clear the IFOM, International Federation of Medical Examination,
Yes.
they will allow to do the PG in Europe, Arabian country also.
Yes.
Yes.
In Arabian countries, it's a bit formal process. It's not difficult, but it's formal. It takes time. You just need to register your curriculum in the councils of education. So this is some paperwork our international office is doing. But we always try to listen to the students and to understand their needs, and that's how we make our priorities. That's why, like, preparing the students from FMG was a bigger priority than registering for the Arab countries, but that's now for the future. We are happy that we can provide FMG now, and our students is less stressed about how can they clear FMG registration, both based on papers, based on the credentials they need to take from the university, and last but not least, mostly because for the knowledge, because we try to build their knowledge and build their confidence to be ready for the FMG. Because India needs good medical specialists, and we try to give our small part, our small effort within it.
That's great, sir. Thanks for it. And sir, main thing is any special message for the Indian student from your side?
My message could be selecting the medical profession is a tough choice. It's a tough choice for the family, and it is tough choice for the student, because in every country the medicine is the same, the human body is the same, and every country understands how much efforts and how long periods of study and the sleepless night medical education will take. But it will be even a bigger challenge to decide, to make a decision to leave the country, to leave the family, to leave the parents and the friends for quite a long period of time, for 6 years at least. And lots of the questions might arise. How I will be welcomed? How can I find myself in the different environment on my own, in the different culture, in the different nation, in the different country, in the different university? We understand this, and in medical profession, we are speaking about 30 years stress, 30 years stress of studying medicine. Whenever these two combine, it will be much more stressful. We try from our side to be a friend for the students, to give them informational support, to give them possibility to communicate with the people from other countries and other cultures, to make new friends before they start to miss the old ones. But most of all, it is not possible with our effort or without the personal effort and the personal motivation. So my short advice after this long introduction will be to keep motivated, to keep yourself motivated, because your decision to serve the most valuable profession in the world will be rewarded. Will be rewarded after a long time, but definitely will be. So be proud of your choice, and let it be your motivation for your sleepless nights and your lots of the studies.
Okay, it's a good information from your side, sir. Thanks. Thank you very much.
My pleasure.